Okay, well, good morning, good afternoon, good evening, wherever you are dialing in from, and really welcome, a warm welcome to all of you to this Women in Tech, Health Tech, and you know, today on this specific panel, we're going to talk about the role of digital health in our post-COVID world and what that will look like. I feel very privileged to have such a, you know, a great panel of women that are so passionate about this area and who are doing so much for the community and business, you know, in the health tech space. And I just want to introduce you all very quickly. We have with us today Debbie Rogers, who is Managing Director of PrEC and is dialing in from Johannesburg. Béatrice Garrette, CEO of Pierre Fabre Foundation and the Observatoire de la e-santé dans les pays du Sud. So maybe if you just raise your hands. Isabelle Hilali, who's CEO of Datacraft, and Florence Gaudry-Perkins, who's the founder of CEO DHP and head of strategy and Intel development at H4D. And these three ladies are joining us from Paris and myself from New York. So you have a, as we say in French, a little brochette of, you know, regions of the world on the panel. So before we jump into the discussion, you know, just want to say briefly, setting a little bit of the context of today's discussion. I think it's fair to say that the role of digital connectivity has grown exponentially over the last few years. But never have we seen what we've seen in the last 2-3 months, right? This is really a digital acceleration. We've gone from 0.2 to 4.0, you know, in terms of digital transformation and acceleration. And it's also brought to the light, I think, how much we depend on being connected all over the world. From remote working, I think, you know, there are more than 300 million of people working from home. Remote schooling. My understanding is there are 1.2 billion of children at the moment that are not in the classroom around the world. And simply as well for just, you know, remaining entertained, connected with family and friends, and you know, really informed as well of what's going on. But I think it's also fair to say that maybe one of the area where technology has really played a crucial role in the last 2 to 3 months is really the healthcare space. And really, you know, from getting the latest information and health guidance to supporting health services, telemedicine, use of track and trace, we've seen such a surge in services, applications, you know, innovation coming to the market to respond to the crisis, to the point that I have to admit sometimes it's quite confusing, and for the user as well, you know, what is privacy friendly, what is security friendly, and what is not. So what we want to focus on our discussion today is also that we know that the crisis is there to stay for a while. It's not just 2 months that we fought and then we go back to normal. The new normal is going to be looking very different. And as we transition to that new normal, you know, we really need to see, and maybe what we want to discuss today is how can we help build more resilient healthcare systems? You know, how do we reset the clock? You know, how do we help governments leverage telemedicine, digital services, and apps to foster e-health? And especially, I think, in areas where, you know, we are really in need of remote medical. And that's not just in least developed nations, but it's also in our rural areas, you know, in Europe, in the US, etc. So I would maybe like to start with a question to all of you, you know, so as a way of introduction, of maybe if you can tell us a little bit of how your organization is involved in the digital health space, and how is your organization has helped over the last 2 months, but is going to help forward, you know, address the COVID-19 response and the new environment, and maybe where you think you've so far have had the most impact. So I'm going to follow what I see on my screen and the order, and maybe Isabelle, may I hand over to you? Just a couple of minutes. Thank you.
Yes, hi, thank you, Isabelle. And hello, everybody. So just on my side, Datacraft is a club for data scientists and data engineers, and we are meeting to share good practices. So one thing that is very specific to our organization is we are not just healthcare related. What is really interesting is to have a data scientist from Manchester United, for example, talking to a data scientist from Sanofi or any big pharma, and someone from, we are in France, so someone from Orange working on mobile services, exchanging good practices. And if you talk about matters such as loyalty, for example, it's very important when you work for a mobile operator to anticipate whether your customers will move to another operator. But if you work in healthcare, it's also very interesting to be able to anticipate whether a patient is going to stop taking his treatment and be, not be loyal anymore in a way to his treatment. And same if you work for a soccer club. So the richness of our organization is really to exchange on good practices and see what you have to learn from each other. And during COVID-19, we saw that both data is very critical in terms of managing the situation, but also collaboration. And we've even teamed up with other organizations. So now we are more than 2,000 data scientist experts who just are giving some time on a pro bono basis to help the institutions. So we are working mainly on healthcare, education, and economics. And I can give two examples of what we do in healthcare. The first one is working, we have many more, but I will give two. The first one is working with patient association, and we are helping them analyze the LinkedIn, Twitter, all the social networks data to better understand what's the situation of people living with a chronic disease and how they can share that. So that's one project we are working on. And the other one is working with the emergency medical services to help them better allocate the resources. So those are just two examples of what we are doing at the moment.
Thank you, great. Debbie, you clearly operate in a different part of the world. So what has been the experience so far and your input and impact?
Yeah, thanks. It's lovely to be here, and thanks for having me on the panel. I think, Prechealth.org, which is the company I'm representing, we've been working for the last 12 years in using simple mobile technology communication platforms to improve health and health services. And examples of that are, for example, our Mom Connect program in South Africa, where every mother who goes to an antenatal visit, their first antenatal visit at a public clinic, is signed up to a service where they receive messaging on how to care for themselves and their baby, but also where they can feedback directly to the National Department of Health around what the quality of the services are that they received at the clinic. That's all run through very basic technology like SMS, USSD, and then also WhatsApp. So we tend to leverage existing platforms that are out there that can be at really large scale to be able to improve people's health and get the feedback system so that we can improve the health system itself. And this is something we really focused on. And as you say, we're based in South Africa, and our work is primarily in South Africa, the rest of Africa, and Southeast Asia. With respect to the work that we've been doing for COVID-19, we realized very quickly when the pandemic started to come to the African continent and to South Africa, that there was just a massive lack of information. Nobody knew where to go for information that could be trusted. There was a lot of information being shared on platforms such as WhatsApp that was actually harmful because there wasn't a good service that was available to provide vetted content. And so what we did was we used some of the technology that we have been developing over a long period of time with Mom Connect to very quickly put up an informational service on WhatsApp, leveraging the scale of WhatsApp to allow people to go and say, okay, this is trusted information around treatment, symptoms, what I'm supposed to do in my country in order to move forward. And that's called Health Alert. It's been taken up globally by the WHO as a platform that they have now in 12 languages, but it's also in South Africa was our first country installation. And it's in 10 other countries all over the world. And globally, we've reached 20 million people with that platform since launching it in early March. We've obviously iterated on top of this. Just a purely informational service is not something that people might engage with long term. It's initially you see a spike in people coming and looking at the information, but thereafter, how do you keep this useful, and how do you ensure that it's useful not only for citizens to find information, but also for governments to be able to respond in their countries? And so we've added functionalities such as ability to speak to health workers around their information, as well as a symptom checking and data capture risk assessment and mapping tool called Health Check, which has now done over 1 million health checks worldwide. So that's the kind of thing that we're doing, using really basic communication platforms, but to get information that's relevant and vetted and services into the hands of millions of people globally.
Thank you. Very, very interesting. And Béatrice, I think your experience is also in a lot in the work in what we call maybe least developed markets or economies. For you, what has been the impact and your role in the crisis response?
So the Pierre Fabre Foundation is a public utility foundation whose mission is to give better access to quality healthcare and quality drugs for population of LMICs. So for 20 years now, we've been operating in something like 20 countries. We're in close partnership with local stakeholders. So it can be Minister of Health, Minister of Education, or hospitals or local associations. So we have different areas of intervention, such as struggle against sickle cell disease, for instance, or training pharmacists. But e-health is important for us now. Why? Because being on the field, we have been witnessing, as all of us, the surge of mobile technology and incredible adoption of mobile phone by all population. In the most remotest village in Africa, suddenly people had access to information, dialogue, and so there was a surge of kind of services as well around this technology. And suddenly people you couldn't reach, you could be reached. And so we witnessed that, and with a lot of interest. But at the same time, because also it was a sort of trendy topic, everybody was so enthusiastic about that. There was a lot of also misinformation. It was difficult to tell, what was wishful thinking, what was really implemented, what was the impact, and such and such. So that's why we decided 5 years ago to create the Global South e-Health Observatory with support of French Development Agency. And the mission of this observatory, of course, it's to observe, but it's really to identify which initiatives has been implemented with success. And what I mean with success, it's bringing a real medical service to disadvantaged population of Africa or Asia. We've based, our observation in these two continents. And the idea is really to document, to go on the field, to do field surveys, and to give access to this information to the community, and also to support the most German initiatives to help them grow and scale up when we think there is potential for scaling up. So far, there has been 150 initiatives which have been documented and are published. And all the information is free for access. It's on our website, which is odess.io. And you have access also to all the servers. And every year as well, we organize a conference, which is also filmed and live streamed. With experts, now northern and southern experts, as well as the laureates, because every year we select between 5 and 10 of the initiatives, but we will support. There is a global grant of 100,000 euro that we share according the needs, and so the idea is really that it helped us to implement ICT in our own program. It helped. The objective also is to share the information and to help grow the most, promising initiative on this continent, coming from the ground.
Great perspective. So far. Well, let me turn to Florence. And Florence, dare I say that you and I go back at least 10 years, that makes us young. Florence is might give a different perspective in the sense that she comes from a background in the ICT, the tech sector, you know, at the time at Alcatel-Lucent, and now more in the healthcare sector. But I know this is something that you've, in any public sector, private sector, position you've been very passionate about this. So tell us a little bit as well of what in particular during this crisis has been, you think, the escalation of your impact in what you've done, you know, in your capacity in your organizations.
Yeah, thank you, Isabelle. Yeah, so I kind of come with two hats a bit today. I'm have been for a while with a company called H4D, Health for Development, which is a company that it's a scale up that provides a telemedicine booth or pod that has about 15 devices or medical sensors integrated in it. So you can imagine a little bit like a futuristic telephone booth, you know, and you lie down in this booth a little bit like you would in a dentist office. And there's a screen by which you connect to a doctor. And then again, you have all these 15 devices that go from, you know, the basics, the temperature and all of that, but then to the blood pressure monitor, to an oximeter, which measures the oxygen levels in your body, an otoscope, which allows the doctor to look very precisely inside your throat, your ear, and all the way to the EKG. There's a self-checkup mode in this cabin where you can be guided by a video, or you connect to a physician, and you know, studies have shown that it can really replace an actual physician, or at least a general practitioner's visit, up to like 96-98%. So it's quite a sophisticated tool as far as telemedicine is concerned. And so this company is based in Paris, and it's been in 10 years of R&D, about 2 years or so of commercial deployment. And interestingly, had been deploying mostly in corporate settings for employees. And COVID has, as you mentioned, accelerated many things, including actually the dream of Dr. Franck Bodino, who is the founder's, you know, sort of wish, because he originally created this to create better, you know, or increased access to healthcare more in underserved zones. So sure enough, COVID has, you know, accelerated this process of us deploying in more public health settings. So the past 2 months, we've been deploying in hospitals and emergency departments. We've been deploying in retirement homes and in more rural zones or underserved zones where there's less doctors, in either health centers or like city halls and such. So emergency departments, it's been reducing, of course, the time for health workers to be spending on taking all of the measures. It's being used as a triage tool, so minus 40%, you know, so it's improving, of course, the patient flow, but it's also reducing the contact, the physical contact, and therefore the risks of, you know, contagion between the physician and the patient. And then in the rest of the settings, as you can imagine, it's just increasing access to healthcare. And then the second hat that I wear is, you mentioned it briefly, Isabelle. I have been a passionate advocate of digital health for a long time now, and created an organization called Digital Health Partnerships back in 2016, which is solely focused on developing and emerging countries and scaling digital health in those countries. So as a result, since I'm reactivating this organization, currently, I've been kind of keeping my ears and eyes open to sort of what's happening at the global level in terms of coordination and cross-fertilizing, and trying to help use these digital tools in as efficient as a way possible in these emerging countries. Thank you.
Thank you, and thank you all for this great. I think that gave us a really great sort of overview of you know, how this crisis has affected the whole world. You know, there was really no borders, but also we see how tech has no borders, right? And it helps us understand really how it has helped in very different way in different regions. You know, Debbie, you were mentioning in some parts of Africa, it's just SMS, typical SMS, you know, that can literally save lives. In other nations, it's something much more sophisticated, you know, from telemedicine cabins and things that we are seeing. But I really would like to move on to this part of our conversation now, where, you know, if we look at more the medium to longer term, what will be the role of health tech in the post-COVID world? So there is no doubt that COVID is changing something in the tech industry, in the healthcare industry. So when you combine those two together, and we're preparing and moving to the new normal, you know, how do you think the crisis has changed the whole health tech landscape and has really set the ground for something new, or again, you know, enabled some of the areas to maybe leapfrog to something that was impossible 6 months ago? And maybe I'll start, Isabelle, you know, I'd like to start with you, because I think at the center of any of these technologies of health tech, data is absolutely crucial. It's the lifeblood of everything, you know, and it's pervasive. And it's been, the use of data has been so critical during this crisis, and very controversial as well, depending on which nation you live and how it's been used by governments, by companies. So do you think this crisis is going to fundamentally change the way we use data, you know, and also the way privacy and data protection rules are used in some areas of the world where, you know, they might have been successful in some countries, in terms of track and trace, and user location. But there are governments and countries where such things would not be allowed. So, you know, given that you are in the heart of the data world, just maybe give us a little bit of your perspective.
Yes, well, I think for sure it has accelerated everything. I was talking to companies who do telemedicine, and they said in 2 months, they made what they were thinking would require them 2 years to make. So clearly it has accelerated. I think the positive fact is that it made things more concrete, because we all talk about, you know, 2 years ago we all talked about the big data. Now we are all talking about artificial intelligence, but concretely, what does it really mean when it comes to healthcare? So I think the interesting thing is that, it brought things more concretely. If I take an example, with our DataCraft community, we worked, for example, with nursing homes for senior people, and really the level of data usage is pretty low at the moment. So we started talking to them about, maybe we can help you optimize the way you work on supply chain, because there were a lot of issues on getting masks, on getting, you know, any necessary equipment. And we thought we could help them just with a simple model to make that more efficient. And then from that, we started talking about how do the nurses and the people work inside the nursing home, and how do you report, and how do you manage information on the status of your residents. You know, we saw that they were very concerned about the impact of confinement, not just about people getting COVID, but also people getting much more dependent just because they don't see their relatives, and the fact that they are being in such a confined position. So from that, we started talking about what do you know, we understood what they needed, and we were making it more concrete. What you can do with data, you can, well, first you can get more information to make decisions, but also you can predict things, you can share information better. And I think I'm just taking that examples, but we work with a lot of players. And I think for everybody, it's making data usage much more concrete. And it doesn't really have to be artificial intelligence. It can just be small data. But what is important is what you do with it. So I think that's the first point. And then what we saw is that people are looking in a more operational way how they should manage their data, because up to now there were a lot of very theoretical things like, okay, let's build a big data lake, and everybody was talking about that, but what for? You had no idea. You just wanted to build that. And I think by making the usage of data more concrete, it makes the way people are starting to collect data more clever too, and that's really very important. And then there are other things that are really important. If you talk about telemedicine, if I take the example of France, during the COVID period, a lot of things have changed, and it has been made a lot more simple. For example, you do not need to be talking to the doctor who knows you, to your referring doctor. It can be any doctor if you think that you might have COVID. Also, it was made more simple and reimbursed by using just a mobile phone for people who had difficulties getting access to something more sophisticated. Older people, for example, or whoever needed could do a WhatsApp or just a simple mobile phone teleconsultation. And that is changing the way people are using it. And also on the other side, I think a lot of doctors who were a bit reluctant started realizing that for some specific reasons, in some specific cases, it's very useful. So what will be very interesting from the data perspective now is to analyze when it works well and when maybe it's not as interesting or maybe as efficient. So we are just at the beginning of it, but it's becoming a lot more concrete. And maybe my last point, you mentioned ethics and responsibility. There were a lot of discussions, and it's very interesting to compare the discussions in the different countries. One of our members, for example, is making a study on the perception of the crisis in a lot of different countries, and it will be very interesting to see how it was seen in the social networks. For example, in China, in Algeria, in Japan. I think it will be a very interesting comparison. If I go back to France, we have an application called Stop COVID, which allows. So initially, the idea was to do like many other countries and we track people and inform people that have been in contact with someone with COVID. And we had the final discussion yesterday at the Parliament, which agreed for the application to be available, but it's not mandatory, so people have to download it. So it's a personal decision, and then that makes a whole difference, I think, whether it's your personal decisions to download it or whether it's mandatory. So I think it's a very interesting debate, and I think it's just the beginning of it also.
Yeah. Thanks. That's very, very interesting and a very rich area, right? Because everything touches upon data. So we might come back in the discussion on those points. But I want to turn to Florence just to make maybe the link with what you mentioned, Isabelle, about telemedicine and the sort of surge that we saw. And Florence, I think it's quite evident that there's been a surge and acceleration of telemedicine. I live in New York. I haven't been able to go to the doctor for the last 2.5 months. I don't even know when I'll be able to go back to the doctor, physically. So my question is, do we think that, and from where you sit, because you've been at the heart of it, and as you say, your founder is very happy, this acceleration. Do you think this is really here to stay, and it's really changing the paradigm of how we use our physicians and how we go as citizens, as we go to the doctors, or do you see more of a hybrid kind of world that we are transitioning to? What is your sort of take on what's going to happen from now on?
Yeah, no, it's fascinating. It's the $1 million question, as some people put it. But just to backtrack and because it's really quite stupendous. I mean, telemedicine literally exploded. There's been more progress in 2 months. Some people say that in 30 years, which is a bit over exaggerated, perhaps, but certainly in terms of adoption rates. You could make the argument that that's true. So just to give you an idea, in France, first week of March, we had 10,000 teleconsultations. A month later, meaning the first week of April, we had 1 million. So we're talking about multiples of 100 here. The same thing is happening in the United States and in the world where, countries were in fact ready to deploy telemedicine at scale. So it's really, really incredible. Now, beyond the fact that adoption rates were boosted for evident reasons, like the one you mentioned, Isabelle, you can't come out of your house. The doctors, the physical contact was prohibited, really, unless you had an absolute emergency, there's been something quite fascinating, which is that all of the regulation, and Isabelle, you just mentioned it as well, has been urgently relaxed, right, to address the crises. Because you have to understand that telemedicine, and this is true of digital health at large, you know, on other applications, is highly dependent on regulations and as well reimbursements. Policies, right? So telemedicine, although there's been some progress, you know, very slow progress over the years, and some things have been allowed, there are many, many countries yet where, you know, a doctor is not allowed, for example, to prescribe virtually. So you might be able to even consult, but if you can't, you know, send a prescription, you know, and sign it off virtually, then what's the point, right? There's a lot of constraints in terms of geography, or for example, in the United States, and even though some states allow it, and that's been also kind of progressing, if you're in one state and a patient is in another, you cannot teleconsult. Medicare, Medicaid, which is, you know, sort of the public health kind of insurance in the United States, say that telemedicine can only be in certain places, in rural areas. I mean, there's, you know, it goes on, the number of constraints that go with this. And in France, Isabelle, you mentioned it, you have to have had seen the person physically. It has to be your primary care physician. Boom, all of this just was out of the window in about 1 week. I mean, the governments all over the place just really completely blew out all of its regulations, including also the data privacy and security, which were very stringent. So all of a sudden you are able to consult a doctor even on WhatsApp, on Facebook, I mean, and on Skype, Zoom, you name it. So is that here to stay? I think that's one of the questions you were asking, Isabelle. I think so. That's my feeling, to a certain extent, of course, maybe not to all. I'm thinking, for example, data security and all of that is, you know, very important, of course, in this field. So things might, you know, not be quite as relaxed as they are now. But it shows in history, you know, with crises like this before, when regulations have been relaxed, that they actually don't go back to the way they are, you know, post-crisis. So that makes us kind of believe in it. COVID is here also. You know, I was listening to one of the head scientists of WHO the other day. We're going to be dealing with this for, you know, at least 2 or 3 years before it's completely in control. And I think there's an inherent expectation that you mentioned it also on building, you know, strengthen, you know, health systems and everything, that the world now has to get ready for things like this, right? COVID may be one, but, you know, in the future years, there may be other pandemics. So for those reasons, I believe that a lot of the rules that have been relaxed will be there. In terms of adoption rates, Isabelle, I think that people who were not quite comfortable with this before, whether it's a physician or whether it's a patient, now that they've experimented and you see all sort of testimonies on this, is that they're not going to want to go back. I mean, there is, you know, such a convenience, you know, sort of factor attached to it as well, that beyond the fact that you might be scared of getting contaminated by somebody, there's, I think once you set foot into something like that, it's very difficult to go back. Thank you.
All very good points. And then that brings me to go to Béatrice. Like, do you think, you know, what Florence was mentioning was maybe more for more developed countries and understandably rural areas as well, you know, the outreach of telemedicine. But I think one of the things we've seen during the crisis definitely is that it has also highlighted the digital divide, right? And in particular in least, if you want, least developed nations. So how do you think, Béatrice, that, you know, building on what Florence said, that technology and innovation can help improve access to healthcare in the most vulnerable populations? And that can be as well, by the way, in the US, you know, I'm not just talking of, but, and can you maybe share some successful leading practices of what you've seen in helping reach the underserved? I know you touched upon a little bit in the introduction, but maybe, you know, where do you think this is really going to change the way healthcare is approached and the way, you know, in those nations?
Yes. Well, in fact, there are 2 points. It's when we're talking about are we going back to the normal world? In fact, in many countries where, you know, the 80% of the population lives with less than $1 per year, the normal world is not normal. It's not normal anyway. So, in fact, COVID is changing and not changing. So also were we very happy that in Africa it's not a catastrophe that we were, dreading. So I know maybe South Africa is a bit apart, but for these poor countries, Western and West Africa, Central Africa, there was really, really a big fear. But if they had the epidemic at the state that we are knowing it in, in the US and in France, they could not cope because they were not able, to deal with the patients if they were really ill. So they are putting all the stress on prevention, information and prevention, and also protecting the health workers. And also they've got the experience from Ebola. They know that the key, the key people are the people, the nurses and the doctors, because there are so few of them already. So this is terrible. If you lose them for the rest of the world, it's terrible. So this is more or less, I think they know about COVID. They're doing what they can, which is not big, but they do the best they can. And in that way, they have been able to acknowledge that some of the initiatives that were deployed for other areas using ICT could be used as well to help monitor the epidemic crisis. And that's a very good thing because, we don't need to build one initiative per problem. We need a transversal, view, approach, structural, That's very important. But you have to start with something. So what is interesting with some good cases, good stories, when it works, it helps people on top, even at the top of the government and all down on the ground to acknowledge that it's useful and that it's working. And that's why it's important to try to promote these stories and to show how it can work. But if you want something really sustainable and working definitely on the highest level, we need, yes, to build up as a global system again, But what we know is really working at the moment in these countries is, I would say there are 4 main areas. And we say, of course, the management of data, health data, patients data, which is crucial. Of course, everything about information, health information of the populations, communication for behavior change. This is important and important as well for the COVID monitoring. Everything about remote diagnostic and consultation, so telemedicine. I would say more tele-expertise than telemedicine. In the settings where we are working, it's we're not encouraging, and it doesn't work so well to have a consultation between a patient and a remote doctor. But what's interesting is to address the lack of specialists and to put into contact a health worker, could be a nurse or a medical doctor, and a specialist. And then you can address the lack of specialists, and you train the health worker so he's able to, sort of diagnose what kind of what patient needs to be seen by a specialist and what can be treated as at the lowest level. This is very important, just to address, to use the medical staff as best as you can. And it's important also to train them to use, of course, all the digital tools. It's part also of their education and promotion. So, and I would say maybe the 4th area, which I think is really crucial, is for the training of health workers, because there is a lack of ability and capacity as well, and there are even, well, depends on the places, the initial training sometimes is good enough, but, during the life of a nurse or a GP, you need to be trained all the time. This is what we have in our developed countries. And this is very important to be able to train all these medical staff. And remote training is the only way that we can address the huge challenge of training so many people. So, in all these areas, there are success stories, which are really important. And what it's important to keep in mind that we are addressing, life and death issues. This is not for comfort, this is not for, a minority of people. It's really a matter of life and death for millions of people. And of course, if you start with the beginning of a life, I think one of the main target are the pregnant women and babies and young children and newborn. You know, if we want the SDG to be reached one day, we need all this technology. And of course, Mom Connect is a wonderful example. So we know of good stories like that in Francophone Africa, for instance, with probably certainly you know Yeda in Burkina Faso, and which is a way to guide in the medical centers, to guide the nurse or the medical doctor into doing the consultation. So it's a training of the medical doctor, but also it helps monitoring the consultation, getting the data, having a feedback on the quality of the consultation, and also providing the data to the health authorities. And now it's something like 40% of all the medical basic centers were equipped with this, system. Mm. So it's a way to give a view for the Minister of Health about what's going on with immunization, with infantile disease and such and such.
Thank you.
This is one example, but there are so many of them. Maybe I'm running out of my time.
No, but you mentioned Mom Connect, and that brings me back to Debbie in a way. And we've seen, I think what we've seen, and at the World Economic Forum in any case, we've seen so many requests landing on our laps for innovative solutions, and what we could do with it to scale them, so much that we had to do, or we did a compendium of at least where we assess it, more than 80 user cases, just from our partners. We didn't even go outside of our partners, and try now in phase 2 of this compendium to sort of see, what really works, what doesn't, and more importantly, what is replicable and what is scalable.
Yes.
So we've really seen this plethora, of health solution. And given that you've been in that space for so long, that you have history in things that have worked, in solutions that have worked, Debbie, what is the sort of the biggest impact that you've seen, some solutions that have had the biggest impact during the crisis, and what has already scaled or you think might scale more, and what are the solutions behind that maybe if you could give a few examples of that.
Sure, thanks. I think you're right. There are a lot of really amazing ideas out there. I think one of the things I just want to mention is that scale in the COVID time is completely different to the scale that I think we were talking about 3 months ago. I think we got on Mom Connect 3 million users over 5 years, and it was one of the largest scale programs of its kind, certainly in Africa, and yet in South Africa, the Health Alert Service attracted 7 million people in 8 weeks. So everything has changed with respect to scale. But I think when you're talking about scale anyway, I think it's important to understand that scale is not just about a vanity metric of a number. There are lots of things where there are millions of people engaging with them. Are they actually improving people's health? And particularly, I think it's about how integrated is it within health services, and how can it actually have an impact beyond just putting agency on the patient themselves. And I think that's something that I've seen increasingly over the last few years is less emphasis on how many people are you reaching, much more emphasis on what is the impact of who you are reaching, and how does it integrate into health systems as a whole, rather than being a standalone piece of technology. And I think the challenging part for many implementation organizations like ourselves is not the technology. Actually, the technology is the easy part. The implementation is the hard part, and proving the impact is also quite hard, because what we tend to do and how we tend to think, and I might be putting too many people in the same bucket here, but I come from a technology background. I am a technologist. You think about how many people can we get onto a platform as quickly as possible, and how scalable can it be, and how quickly can we get the data out of it and visualize it, but you don't particularly think about, is this something that is going to give us an exact return on investment? So why should a country, and particularly in the countries that I work in, where budgets for health are extremely low, why should I spend $1 on an immunization or $1 on a digital health solution? And that's been incredibly hard to prove in many instances because of the fact that the health system and digital health have been so segmented. Those two things have not come together properly. And so many of the metrics around implementation have largely been about scale. But what we're seeing now is, because of data, really, like Isabelle was talking about, and the ability to connect different data systems and the interoperability standards that have been adopted by many countries, we're starting to see much more of an idea of not only has there been an impact, but has that impact been worth the spend? And I think that's, not many places have got that exact number right yet, but that's certainly where we're going. And I can see a lot within the COVID space, particularly, the things that are standing out are often those that were tested in the Ebola crisis. I would say tested. You've seen their adoption very quickly. They learned a lot of lessons, and they've been able to show what the impact was. And that's particularly in the space of screening, and in digital tracking and tracing, and the value that brings. And I think of many examples, including things like the ComCare tracking and tracing system. But I think it's really important to consider all of those things when you're talking about impact. we can put some great numbers on it. We can say we saved 8 lives or 8 million lives. But what is the actual return on investment? And I think that's a bigger question that hasn't quite been answered yet.
So I think that there is such a richness here of conversation and so many areas that we have covered, that it really tells you already what's the scale, of the issue that we've been facing, the crisis we've been facing, the response that was needed, but also the amazing opportunities that they are, moving forward in really, I hate to say leveraging this momentum, because clearly it's not a happy moment, but maybe lessons learned, right? That we can build on. I see that I have on the feed a few questions, and from the audience. So I think it would be interesting maybe to take some of the questions now, because we don't have too much time left. Whoever wants to take these questions. Given the context, how about mental health support? Because in fact, yes, we haven't touched about that. Everybody's working from home, everybody's isolated. Who would like to take this interesting question about the impact and the support we can give on mental health?
I think I have a very specific example around mental health for health workers. And this is not actually even something in the COVID-19 era, but rather that, as Beatrice alluded to, we have an absolute dearth of trained health professionals in South Africa, in Africa, everywhere from community health workers up to specialists. Just for example, in sub-Saharan Africa, we have 24% of the disease burden, and 3% of the health workers. There is absolutely no way that health workers can possibly cope under those circumstances, and yet the mental health of health workers is ignored to a large extent. And so what we've seen with our Nurse Connect program is really focusing in on building resilience amongst health workers, particularly nurses and community health workers, where they don't necessarily have the support that some other specialists might have from a mental health perspective, but they're able to learn techniques to cope with the stress of their everyday environment. And of course, with COVID, that's simply been exacerbated. The stress on health workers, I think, is really intense. And while there are some initiatives there, I think there's still much to be done in that area.
Isabelle, I saw your hand. Did you want to add something? Question?
Yeah. Well, we saw that there is really a lot going on the psychiatric side. And one thing that is interesting with telemedicine, for example, is that you can collect more data, more information, because in France, we have quite some information on psychiatry because it's reimbursed. But when people are going to see a psychologist, because it's not reimbursed, there is less information available. And with the telehealth, well, both are captured, because you can access to both as remotely. So I think it would be very interesting to collect information from that. And also we saw that in a very specific period like this one, it was very useful to be able to get some support, at least remotely.
Thank you. Interesting. Florence, you want?
Just very quickly, in general, this is pre-COVID. There's been, multiple sort of companies. I've seen a lot of things happening in the United States around mental health, around telemedicine. So I think that's on the rise in a big way. It's, many of the consultations don't need an actual physical, sort of examination. So it makes so much sense. You can also imagine kind of the privacy, that you can, sort of enact in an appointment. And I think this is obviously due to accelerate it in a big way for all the reasons that we've cited. All of a sudden, people are adopting telemedicine more. So this is going to be a huge area. I think it was to some extent already, but and it's going to be increased, obviously, also by all the stress that's caused and the worries around the mental health during this period.
Thank you. And beyond mental health, I think we had a call with a lot, over 25 CEOs of the tech companies yesterday, and they were saying as well the emergence of health issues beyond mental by working from home, right? Simply, I mean, I can speak for myself. I'm sitting on a terrible chair at the wrong table. I can see already so many things that are going wrong. And whilst it's fine for a month or two, if that is going to be long term, there are going to be really a lot of health effects, right? Side effects of working from home. There is another question about, are there particular specialties, and I think by specialties, maybe it's meant solutions, that seem to be leading the way in terms of tackling challenges to virtual visits? So remote monitoring, test results, etc. And I think maybe we've touched upon a little bit, but if you want to just very briefly repeat, Béatrice, I see your name.
Yes, sure. In fact, we've got an experience for 6 years now. We're working with dermatologists for setting up, teledermatology. But that's what I would say. It's more tele-expertise. So it means between a health worker and a dermatologist. Just also to set up a landscape, in sub-Saharan Africa, there is one dermatologist for 1 million inhabitants. And so, the access to diagnose and proper treatment is really, really low. So the idea, and it's been experienced first in 3 regions in Mali, and also regarding the impact, there was a publication, a scientific publication. It was evaluated, and after that, it's been scaled up in the whole country. So now there are 80, health centers where people have been trained, and when they are able to recognize what's serious, what they can treat by themselves, and what needs to be to get an advice from a dermatologist, and with a platform which is special for low internet. It's been designed by the Raft. It's called Bogu. It's a local. So they send the message to the dermatologist. There are only 15 of them. And within 22 hours, they give, a treatment and a diagnosis. Even if further, examinations, of course, it's dealt with as well. And this is really working because now, people have access to a diagnosis of a specialist. Otherwise, some of them will have to travel maybe, 1,000 kilometers to go to the capital, to go to Bamako, where the dermatologists are. And as it is working like that, the interesting thing is that we are replicating this program in Togo and also in Mauritania. And now we've got Niger as well. Niger is asking to use the same platform and the same program. And this is really interesting. Of course, with dermatology, it's easy because it's also, the picture is very important. It's the skin and so. But you can certainly use the same kind of, protocol for other diseases as well. And I think this is very, very encouraging for future.
I look at the time and I think we only have 5 minutes left, not even. And maybe, I know, Béatrice, you have to leave us a little bit early.
I'm sorry. So
I would like us maybe to wrap up in the last 5 minutes with, what is the most valuable lesson that you've learned personally from COVID-19 in your area of work or personally, and maybe Béatrice, you know, given that you have to go, like maybe if you want to give us in a couple of words.
For me, I would say, you know, really health is a common good. So we address all interdependence, so wherever we live.
Florence, let me make it in your area. You know, like one of the things that we haven't really, you've touched upon regulation, and you know, that's my background as well, policy. And we've seen, for instance, at the forum, what we did at the World Economic Forum, 3 weeks after the outbreak, we really teamed up with World Bank, ITU, GSMA, to look at how we could increase capacity of the networks or maintain the capacity of the networks. How could we help having more affordable services for others? And that were asks on governments. Governments, exactly in the same way you said for the healthcare area, governments in the ICT space, ICT ministries, regulators had to relax some rules on, you know, releasing more spectrum, allowing infrastructure sharing, all these things that were going to enable people to remain connected. Do you think, you know, as a lesson learned of this crisis, do you think that the two areas, the health sector and the tech sector, needs to work more together and deliver the same common message to governments so that we leapfrog a little bit with these bottlenecks and we address in a more efficient way the bottlenecks that are affecting both sides and hindering some innovation?
Yeah. That's been one of the big challenges, I think, in digital health over the years. You know, I always said, and this was early on, you've got doctors, you know, who come from one world, and you've got the engineers who come from a different world. They all have their set of acronyms. I mean, it's taken a really long time to bring those two worlds together. We're getting there. Certainly it happened faster in the private sector, but then you're absolutely right. It has to do, and when you look at what needs to happen on a national digital health strategy, it needs to be something that is defined between the Ministry of Health and the Ministry of ICT, Telecom, e-government agency, whatever it's called in that country. To me, that remains one of the biggest challenges there is, because you can talk about the lack of connectivity, but the bottom line is, and I came from that world, and you did too, Isabelle, that's engineers working with engineers. And of course, it's a highly complex issue, but it's going to get done, right? Business models is another big constraint. Well, yeah, the health insurance world is very late in waking up to all of this, but you know, we're getting there. But getting governments to understand the importance of setting up these common platforms, these standards, so the data can speak to each other, that's a huge undertaking, because you got to get the leadership going, but then you got to get the government to understand that you need to put funding into implementing a national digital health strategy. And that, to me, remains, you know, there's been a lot of progress. You know, I think 52, 53 countries in Africa have a national digital health strategies, but really only 7 of them in Africa have actually moved in implementing them concretely. And that's tough, because that requires a lot of money. A lot of people need to be convinced. And plus, this cross-sectorial thing you referred to, Isabelle, getting 2 ministries to work together is not easy. It's easier to get like a pharma and a tech company to work together than the two ministries.
Hopefully we have a lesson to learn here to accelerate that cooperation.
Hopefully that will accelerate things. Certainly you can see WHO and ITU are the two, you know, sort of health and ICT arms of the United Nations. They've been collaborating for years, but you can see even during COVID that's even gotten strengthened, accelerated, and we got to keep, you know, we got to see this just happening faster, hopefully.
Thank you. I think we've lost Isabelle, but Debbie, maybe your last word of wisdom in the half a minute we have left on your most valuable lesson.
No problem. I think my last word of wisdom, if I can say it without coughing, is just, I think more than anything, we have realized that in this space, perfect is the enemy of done. I think in the digital health space, we spend a lot of time trying to come up with the perfect solution and ensuring it has the perfect impact and it's tied into all of the perfect things. And really, you know, sometimes you just need to get something out there and you need to iterate on it quickly and you need to build it into what you want it to be. And I think that COVID-19 has certainly taught that. And obviously, this is a tech forum. It's not something we necessarily need to teach tech people, but in the digital health space, there's been a lot of caution around that approach. But I think the services certainly that have scaled up quickly for COVID-19 have really used that approach of getting something out as quickly as possible and iterating on it. And I hope that that's something that continues to be a principle that is beyond COVID-19 for digital health.
Thank you. Well, thank you, everybody. I think Isabelle and Béatrice had to step off just a minute before the end. I think that has been really a very interesting conversation, a very rich conversation, and I guess a stepping stone, right, to where we are going. Isabelle, we have you back. Maybe you want to say a few last words on what is your biggest lesson learned? Like,
well, Wi-Fi is a disaster. Is that a good lesson? No, well, besides that, well, maybe one thing that is really important, especially if we want to use data in a sustainable way and for healthcare, is that we really need to work on our soft skills. Collaboration, respect, responsibility, creativity, those are really key. And I think that's one of the lessons we are really realizing even more during crisis.
Thank you. And I'm glad you brought collaboration, because that's really the essence of the World Economic Forum. We are the international organization for public-private collaboration, and never so much as in this crisis we've seen this. I'm very glad to tell you that we are working on getting you better Wi-Fi and capacity. So, you know, watch that space. But I think the networks, to be frank, the networks have coped remarkably well, you know, because we are talking here of an escalation of hundreds of millions of people using 5 times devices that they used to, using, you know, airtime capacity, video streaming, working, schooling, etc., everything happening from the home. But for me, this has been a great opportunity. All respect for you, ladies, for the work you are doing. I think it's amazing. And we need you, we need more of you. And if anybody in the audience is interested at the forum, we really are building platforms across, you know, like for me at the moment, it's really working on infrastructure and services in the digital world. And I'll be delighted to have any of you join us on that platform, because the network operators need to understand as well, what are the needs, what is the demand from your side, in terms of how best we can work together to build the infrastructure of tomorrow, to build more resilient healthcare systems. So this has been a fascinating conversation. Thank you so much. And thank you for all the audience, everybody in the audience that we cannot see. But thank you so much for your participation, your time, and your attention. Thank you and goodbye.
Thanks, Isabelle.